Hello, everybody. My name is Dr. Kanya Ferguson. I am a physician at the University of Iowa Healthcare in the Department of Dermatology. I'm very happy to be here and happy to speak with you for the next few minutes to talk a little bit about my path to medicine and what I do as a dermatologist. So I'm going to go ahead and share my screen here. So when I talk about, kind of why I decided why I wanted to do medicine, I like to talk about my background and my upbringing to, I think, really explain why I decided to become a physician. So I was originally born in the United States, but when I was very young, moved to my dad's home country in Zimbabwe, which is in Southern Africa. Growing up there in more of a developing country where resources are sometimes very scarce, I really experienced firsthand some of the effects of not having access to healthcare and the ability to afford physicians or afford even medicine. For me, a very personal experience was experiencing my grandmother's illness. She lived in the rural areas in Zimbabwe, and I'd like to put a picture right over here that shows an example of what the hospital looked like when she was admitted there. She had heart problems, had a lot of problems breathing. The hospital had no oxygen, and the only physician wasn't expected for several days. My grandmother ended up dying before she was able to see a physician, and that really set the stage for myself and my motivation to become a physician. So after I had finished my high school, I moved to the University of Missouri, where I graduated from undergraduate and medical school, and then moved to the University of Iowa, where I completed the rest of my training in dermatology. To talk a little bit about what's involved in becoming a physician, I really like to look at it as a marathon, and that there's a lot of material to learn, especially if you want to take really good care of your patients. And so because of that, you have to dedicate several years to doing this. So after medical school, I went to college for 4 years where I studied biochemistry, and a lot of people will major in different science fields, but there are people who will major in things like music or the arts and do their, basic science courses to be a pre-medical student. So there's a lot of variety in the things that you can get a degree in based on your interests. After college, I then went to medical school, and within medical school, the total amount of time that you're there is 4 years. For the first 2 years, there's a lot of kind of book work and classroom work where you're learning about how the body works and learning about different disease processes. And then near the end of your medical school is when you start to experience patient care firsthand. So you have the opportunity to rotate through a whole bunch of different specialties, like anywhere from pediatrics to surgery to neurology and psychiatry. So you learn a lot about a lot of different aspects of medicine. And near the end of your medical school is when you decide what specialty that you want to dedicate your practice to. And so for me, that ended up being dermatology, which I'll talk a little bit about how I came to that decision. But within dermatology, because it's a lot of these specialties are very specific, there's a lot more to learn in addition to what you learned in medical school. So for dermatology specifically, I did 1 year of what we call an internship year, where we do a lot of kind of inpatient medicine where patients get really sick and need to be admitted to the hospital. And it was a very good experience where I kind of learned in a big general field of medicine. And then after that, I did 3 years of dermatology residency. After that point, I graduated and became an official dermatologist, but was hungry to learn a little bit more about my specialty and had the opportunity to do even more specific training within dermatology. And for me, I had a very strong interest in doing procedures, so I did an additional year of surgery. So when I was going through medical school and trying to decide why dermatology, I had never rotated through dermatology or never followed a dermatologist. And so in my mind, I thought dermatology was just acne and psoriasis and eczema or warts. And I wasn't quite sure if that's what I wanted to do and why I went through so many years of training. But what I found is that it's so important to actually experience and shadow and actually see what a specific specialty is about before making a judgment or a decision. And so when I finally did my dermatology residency, I found that it was just so much more. I saw just really cool and neat diseases. So skin diseases where there's a disruption in the building blocks of the skin structure that holds everything together. So then you start to develop these fragile blisters. Found how the body and on the skin reacts to diseases or infections that are affecting the body internally, but that present on the skin. So a disease that almost presents like almost these target-looking spots called erythema multiforme. There's also diseases that affect the blood vessels that supply nutrients to the skin, and then you start to get things like the skin turning a little bit purple in something that we medically call vasculitis. You start to see changes on the skin like this. And then other very interesting skin disorders where you may develop scars underneath the skin, so something called morphea or scleroderma. And so by doing the rotation, I was sold. I thought this was the coolest thing ever, and decided to do that specifically. But the other things I liked about dermatology is that I got to see adult patients and got to see pediatric patients. And it's very neat that I got to follow patients from when they first presented, help them with their skin disease, and continue to follow them, as they, for several years. In the setting of where I was able to do my practice, I could do it in an outpatient setting, so seeing in a regular clinic, or I could also see patients while they were sicker in the hospital. With dermatology, the other thing I liked about it is that there's a very unique psychological component, because a lot of the diseases, because they're on the skin, where other people can see, really affects the patient's, mental health and confidence. And so it's really, really special for us to help patients with their skin diseases and help build that confidence. The other really cool thing about dermatology is when we're not quite sure what's going on with the skin, we can take a sample of the skin and actually look at it underneath the microscope. And so we very much become a detective when we see a patient and try to put the pieces and the puzzles together, but then also get the opportunity to look at the skin underneath the microscope and learn about what's going on from microscopic perspective. And then I'll also show a little bit later all the different procedures and the ability to work with your hands within my specialty. One interest that I do have also is I have and run an ethnic skincare clinic where I get to take care of patients with skin disorders that tend to affect patients with darker skin. And there are some diseases that are unique to patients who have darker skin, but even common conditions may affect the skin a little bit differently because there's pigment in the skin. And also how you do procedures on the skin is very important too, so you're not causing more harm than good potentially. So I just put up an array of just a lot of different skin diseases that I see that come through my clinic. Diseases where the immune system fights off the pigment in your skin and leaves white areas, so something called vitiligo. Different scarring processes where for some reason your body doesn't tell your scarring process to shut down, so you get scars that overgrow. And this example over here is of a keloid from someone who had their ears pierced. Things like skin cancers can develop on the skin, especially on the bottoms of the feet or under the fingernails. So this is melanoma in some of my patients. But even things like acne that the body essentially deposits more pigment underneath the skin if you have a slightly darker skin. And so just looks a little bit different and may affect the skin a little bit different. I spoke a little bit about doing procedures within dermatology, and so we get to do, in addition to seeing patients, get to do many, many procedures throughout the day. So I love the variety of working with my hands and caring for patients. And so it's really neat when I see a patient and I can look and see that, hey, you have a skin cancer. I can biopsy it by a number of different ways. This is just an example of one way to biopsy. And then look at it underneath the microscope and say that, yes, it is a skin cancer. And then I can have the patient come in and then actually do the surgery to remove the skin cancer. We're also doing a lot of things using cryotherapy or liquid nitrogen to freeze things like warts or pre-skin cancers, and can inject a number of different things within my day. One special type of surgery I do is a surgery called Mohs surgery, where I do surgery for skin cancers on the face. The thing I love about this type of procedure is that, I use what we call local anesthesia, where we inject numbing medication, but the patient's awake throughout the procedure. So we have just such a wonderful time to sit and, talk with our patients while we're doing the surgery that takes a little bit longer to do. But this is just an example with someone who has a skin cancer on their nose. This is an example of how we would cut that skin cancer out. And within my clinic, we process the tissue and actually have a room where we have histotechnicians that freeze, stain, and cut the tissue for me. And because I'm also trained to look underneath the microscope, I can see if there's still skin cancer remaining or if we cleared all the skin cancer. If there's still skin cancer, I know exactly where to go in, take a little bit more, and then we use plastic surgery techniques to repair the area. We do a variety of different lasers that we have the opportunity to use, and this is just a few examples of lasers for hair removal or lasers for tattoo removal, among other things. And also because of my history and my interests and my upbringing, I also have a very strong interest in expanding and offering care to folks outside of the United States. So there's a aspect of medicine called global medicine or global dermatology, where I have the opportunity to travel to other places around the world and learn from the physicians in these other countries, but also have the opportunity to share some of my own expertise as well. So I wanted to end with just talking about a little bit about what my day looks like, kind of on a day-to-day basis working at the University of Iowa. So I talked about I have the opportunity to see patients who come to my clinic for a variety of different issues. And then, some of the time we'll also, throughout the week, we'll spend time specifically doing surgery on a number of my patients. One of the really neat things about being at the university is that I have the opportunity to work with medical students, with undergraduate students, high school students, and also residents. And within that, I have the opportunity to teach about not only medicine, but dermatology. We also have the opportunity to do research, and some people, spend a lot of their time doing research, kind of more bench side research with test tubes, but you can also do research based on the patients that you see. So if you have a question of, does this treatment work well for my patients, then you can create a research study where you can actually prove whether it does or not, and really help your patients in the future. And then part of my job too is I do have to do some meetings throughout the hospital, but really gives me an opportunity to help how our clinic works and also help how our hospital works as well too. So there's so many different opportunities. I have so much variety in my day, and just enjoy coming to work every day. So I hope that my presentation was helpful. It was such a pleasure, again, to have the opportunity to share about what I do, and I would like to thank you. Bye-bye.